In recent years, the term depression has been increasingly used to describe a variety of emotional states. Psychologist Marian Rojas stresses that many people are not really depressed, but experience an empty life. This phenomenon requires a careful approach to avoid diagnostic confusion.
If you like this content, don't forget to subscribe and like the video.
It's essential that more people know the difference between depression and existential emptiness. Today, we're going to delve into this issue so important for our mental health.
Existential emptiness is defined as a sense of lack of purpose and satisfaction in life.
It is not considered a mental disorder, but a common human state that can cause anguish and disconnection. According to Viktor Frankl, this happens when we find no meaning in our existence.
Studies indicate that existential vacuum is related to feelings of hopelessness
and may increase the risk of developing anxiety or depression. It is essential to address it in time to avoid more serious consequences.
On the other hand, clinical depression is a diagnosable mental disorder that involves persistent symptoms such as deep sadness and loss of interest. This condition requires a specific treatment that may include therapy and medication.
It is important to clarify that although depression may include feelings of emptiness, not all cases of vital dissatisfaction should be considered depression. There are significant differences between the two.
Depression manifests with clear and persistent symptoms for at least 2 weeks,
affecting various areas of life. In contrast, existential emptiness can be less intense and more temporary. In addition, in depression there are biochemical alterations in the brain, while the existential vacuum does not present these changes. This is crucial to determine the proper treatment.
Differentiating between existential vacuum and depression is essential to provide the right help.
Depression may require medication, while existential vacuum can be addressed with psychotherapy centered on personal meaning.
It is a mistake to offer antidepressants to someone who does not have depression,
as there will be no positive effect. The key is to understand the root of the discomfort and not simply label it as depression.
Marian Rojas invites us to reflect on how we interpret our discomfort. Sometimes being ill does not mean being sick, but is a sign for making changes in our lives. The real cure for an empty life is not found in drugs, but in reconnecting with our values and purposes.
No one else can do this work for us.